the Prime Minister is now not even restricting flights from COVID hotspots to stop the entry of new dangerous variants. The Prime Minister failed at the border last year. Why is he failing again?
The Prime Minister under increasing pressure to slow or stop air travel from India as Canada sees its first case of the B1617 COVID variant first spotted in that country. Justin Trudeau says Canada's existing border measures are doing the job, but wouldn't rule out new, stricter rules.
We have some of the strongest measures in the world on the borders, but we will also continue to look at other ways based on science and data to keep Canadians safe. Importation from the border is a fraction of the cases we're coming in, but we will still make sure we are doing everything necessary to keep Canadians safe.
India's current wave is close to overwhelming hospitals and the healthcare system and is on pace to reach 300,000 new cases daily.
It's an emerging situation, not just because of the variant of interest at this point, but because they have a very unfortunately, a very massive resurgence in that country, and we'll be doing that risk assessment again and using the data that we have now collected at the border to inform our next steps.
It's not enough to say you need to have a test result from beforehand because they can be false negatives, they can be fake. It's not enough to say you need to stay in a hotel for maybe 3 days, maybe much less than 3 days, while you have an arrival test process, because people will continue to develop COVID. So they may test negative and still go out and spread.
Dr. Colin Furness specializes in infection control and says a simple travel ban is too easy to avoid. Instead, he says Canada needs to tighten up its quarantine rules.
New Zealand has a good system. You go to a quarantine facility for 14 days and you're tested repeatedly. Even there, once in a while, a case gets out. But because they have almost no COVID, they're actually able to manage that really, really well. So there are examples of countries that have done it really, really well.
Now, details on the first Canadian case of B1617 are still scarce, but reports indicate the person is in Quebec in a region northeast of Montreal. Quebec's public health lab says the person tested positive for COVID 2 weeks ago, but further information like the patient's condition or where and how they were infected are still not available. In Ottawa, Xiaoli Li, City News.